Hello, and welcome to Newly Diagnosed Building a Better Life with Parkinson's. Thank you so much for being here. A few notes before we get started. All attendees will be muted during today's program. This helps us reduce background noise and echo. You can submit a question today by using the chat function and the black banner on the bottom of your viewing page. The program today will last about 2 hours. So again, feel free to use the restroom, get up and stretch whenever you need to. We have a fitness break during today's program, but feel free to get water and move around as needed. And again, please feel free to submit your questions via the chat throughout today's program. We'll get to as many of those questions as we can. Another note, we will be recording today's program and we will make that recording available to all of you guys as soon as it's ready, probably by the end of next week. All right, I want to thank some of our wonderful Georgia chapter supporters. These companies help support the Parkinson's Foundation Georgia mission. They help us put on programs just like this. And we are really fortunate to have their support. So we're going to go ahead and put a link to our chapter supporters page in our chat. So please feel free to check out those companies and the therapies and services that they offer to our Parkinson's community. All right, so just very quickly, I want to talk to you a little bit about our Georgia chapter. So the Parkinson's Foundation, we have offices in New York and Miami, but we also have folks like me all over the country who help manage our chapter offices. So the Parkinson's Foundation Georgia chapter is really a great resource for those of you guys, especially who have been newly diagnosed and are looking for local resources, local events. One of the things that we do is we work closely with our 2 centers of excellence that are here in the state of Georgia. So you guys are really lucky that you have access to a center of excellence in Atlanta at Emory, and as well as in Augusta at the Medical College of Georgia at Augusta University. We also here in Georgia have something called our PD Gladiators Fitness Network, which is a network of more than 80 weekly fitness classes that have been adapted for people living with Parkinson's. Obviously, COVID has changed sort of our fitness programs. However, many of these programs will be up and running again, and some of them are even offering virtual classes as well as some small in-person classes. So definitely visit our website at parkinson.org/Georgia to learn more about our local resources and events, our PD Gladiators Fitness Network, as well as Moving Day Atlanta, which is our annual walk for Parkinson's. All right, one thing that we are doing nationally as an organization to help support you guys during this time is we're offering virtual programs through our PD Health at Home virtual program series. So every Monday, Wednesday, and Friday, we actually have mindfulness programs where you can meditate and sort of work on stress reduction. We have Wellness Wednesdays. So every Wednesday you can tune in to hear from a different speaker on a different topic, which is really exciting. And every Friday we have on-demand fitness videos that we actually post to our website. So definitely visit parkinson.org/PD Health to learn more about our PD Health at Home virtual programs. All right, and next week I want to just briefly touch on the program we have coming up. This is through, again, it's our Wellness Wednesday program, and the focus will be on vertigo and dizziness, which is those are very common issues among those living with Parkinson's. And actually, we'll be hearing from another Medical College of Georgia at Augusta University speaker, Dr. Julie Couric, will be speaking next week, so we're excited to have her. So again, you can visit parkinson.org/PD Health to learn more and to get registered. All right, and last but not least, I just want to briefly tell you guys about an exciting genetics initiative that the Parkinson's Foundation is offering called PD Generation. It is the first national initiative that's actually offering free genetic testing and counseling for Parkinson's related genes. Anybody with Parkinson's is eligible to participate. You can participate at one of our centers of excellence. We have a few that are offering this service in person. You can actually also participate via telemedicine. So you can contact one of our centers, set up a telemedicine appointment, and actually participate in this very exciting study with an at-home cheek swab. So for more information, you can visit parkinson.org/PD Generation. All right, without further ado, it's now my pleasure to introduce our keynote speaker today, Dr. Colin McLeod. I'm going to get my notes because I don't want to miss anything. So Dr. McLeod is from the Medical College of Georgia at Augusta University. This is what Parkinson's Foundation Center of Excellence. Dr. McLeod completed a 2-year fellowship in movement disorders following Neurology board certification, specializing in the clinical care of patients with Parkinson's disease and Parkinsonism, essential tremor, dystonia, and other movement disorders. His special interests include deep brain stimulation, botulinum and toxin Botox injections for movement disorders, and advanced therapies for motor impairments and Parkinson's. Dr. McLeod's research interests include DBS, quality improvement for movement disorders, Botox for treatment of movement disorders, and exercise benefits in Parkinson's, which the Parkinson's Foundation, we are big believers in the power of exercise. So without further ado, Dr. McLeod, welcome to the program. Take it away.
Okay, I'm officially unmuted and hopefully can be heard easily. Give me just a moment, I'll share my screen. Okay. My name is Colin McLeod. Just like Annie said, thank you so much for this opportunity to speak to those newly diagnosed. In clinic, it is one of our kind of favorite things to walk people through their new diagnosis. It doesn't mean it's easy, but sometimes we don't have time to go over all the nuance of the things that we're trying to express. So this presentation is mostly slides furnished by the Parkinson's Foundation, so you know it's good. And I'll try and walk through that, the newly diagnosed slide deck that they have. So without further ado, because our time is short, we'll go a little quick. Okay, so what we're going to cover today, any one of these topics could be a whole presentation, but we'll walk through what is Parkinson's disease, who gets it, how best to go about getting a diagnosis, managing symptoms, what to expect, and then a little bit about building a care team. I know others are going to touch on that too. And then 5 quick steps for living well with Parkinson's. So what is Parkinson's disease? So it is a brain neurologic disorder. I've got some figures I think that might help this in a little bit, but it's characterized by affecting movement, mood, and thinking, mostly diagnosed by movement symptoms. It's important at the outset to discuss that there is no cure for the underlying brain disorder. We don't have a cure yet to repair the neurons that are dying, but we have a whole lot of symptomatic treatments, and we'll go over some of those kind of things and what to expect from that so that you kind of live well with this disease. It does progress over time. Symptoms can worsen over time, and we then have to adapt our symptomatic treatments to that progression in each individual patient. Lifestyle interventions, we'll say upfront, exercise can possibly slow disease progression. We'll talk about this probably 3-4 more times, but exercise in Parkinson's is the only thing that's ever shown evidence to slow the underlying disease process of Parkinson's. Not any of our fancy medications and trials, despite many efforts. Exercise is actually the best fight for the actual brain disorder. So what's happening in the brain? There's a loss of nerve cells that produce the neurotransmitter dopamine in the substantia nigra. So I'll have a figure that can kind of show this in a little bit, but essentially you're losing part of somewhat of the gasoline that helps modulate your movements. So dopamine can help kind of control and coordinate movements and smooth movements out, especially coordinating rapid, alternating and consecutive coordination of movements. And so that's where our primary target is for symptom benefit. And we'll go over that in a little bit. That goes right into medications. This is a neurochemical disorder, so it really sets up nicely to be treated by medications, actually. Dopamine also affects other functions in the body. It is true, sleep, speech, bowel mobility, cognition, mood. It doesn't just affect motor movements. And people see that often when they start a medication replacement. They'll see multiple improvements, not just in their movement symptoms. And yes, it is characterized by tremor, slowing, and stiffening of movements. Specifically, tremor is not enough to diagnose Parkinson's, just at the outset. Many patients have tremor as their biggest symptom, but it's characterized by the inability to sustain and coordinate rapid movements in a special way. So getting that goes into getting the diagnosis properly is tremor does not diagnose Parkinson's. This, yes, can affect multiple systems in the body. Symptoms can vastly vary from person to person. We'll talk about that quite a bit here. And early symptoms can be just of resting tremors, movements, slowness, and stiffness. So here again, tremor in the hand and foot. Parkinson's is not the most common reason to have tremor. Number one, that's actually essential tremor, but it is a special kind of resting tremor. Typically when you're sitting watching television, you might notice if your mind is otherwise distracted that you have a resting tremor, not when trying to actually use the hand. Tremor affects about 70% of patients with Parkinson's. That feels about accurate in our clinics too, but many people never develop tremor, and that's okay. That's not reliant on the diagnosis. The slowness and trouble with sustaining movements called bradykinesia, that is what defines Parkinson's clinically to diagnose somebody. And then stiffness and rigidity in muscles is another feature that can occur in Parkinson's as well. And problems with walking and balance. Eventually, you can pick that kind of thing up, but that should not be the big mainstay to the early diagnosed Parkinson's patient. But we would talk all about that. So this is one of the slides that I added here, and I feel like most patients can handle this. Usually, sometimes we talk about it in clinic a little bit. It's a little sciencey, but so what we've been talking about so far is this portion here. So deeper in the brainstem, these are where these neurotransmitters are stored and then projected into the brain. So I find this helpful if you look at this black dot. You may or may not be able to see it, not a big deal if you can't. But that black dot projects the dopamine into the middle of the brain, which then helps coordinate movements. So therefore, if you're losing your gasoline that's projecting into the middle of the brain, that's one of the therapeutic targets that if we give you your dopamine back, ideally we start to smooth out those coordination of movements and get you with reduced rigidity and those features. So that's why we do that. But this is an important slide too when talking about non-motor symptoms. The dopamine side we've known about for a long time. The better part of 200 years, we've been able to see those neurons on autopsies that had died off in a Parkinson's patient. We've known about that. But what didn't get enough attention is that neighboring neuron stores like norepinephrine and serotonin and acetylcholine also get hit. And that's where we get a lot of the non-motor symptoms. And it's important to talk about this more and more and more with your Parkinson's specialist, because symptoms like depression and anxiety and to some degree agitation, apathy, so decreased motivation, those are all modulated by serotonin and norepinephrine. And in Parkinson's, it sets up very nicely to be treated. So this is an important figure to understand a little bit of, is just to know that we're talking a lot about dopamine, but that's not the only way that we help symptoms in Parkinson's. Same with acetylcholine, we'll talk about as well, is that medications that were designed to treat dementia, like donepezil and rivastigmine and those medicines, work a heck of a lot better for our patients than they do for the Alzheimer's patients, because just replacing that neurotransmitter tends to make people feel sharper. So it's an important thing to talk about. And this is the Parkinson's Furnish slide, that we should pay attention to the non-movement symptoms as well. Some patients might not get any of these, but if you do, speak up. Because we have lots of ways to treat these kind of things. So a pivot in depression, a pivot in anxiety, lack of interest, apathy, thinking, paying attention, multitasking, learning new ideas and tasks, sometimes a little bit of word finding. You know, you can pick some of those things up. Not everybody does, but people who do speak up. And then additionally, speaking, swallowing, some people might pick those issues up. Sleep, talk to your physician about sleep, because we might be able to help with things like that. And decreased energy, constipation, and then blood pressure drops when standing is another one that's a common topic to talk about in our clinics as well. We can circle back to any of these kind of topics in the Q&A or these other features. I know I'll keep moving, but we could have a whole lecture just on non-motor symptoms. So who gets Parkinson's disease? So it is very common. Parkinson's is unfortunately common. It's the second most common neurodegenerative disease after Alzheimer's, 1 million in the US. Excuse me. Most people are diagnosed in about their 60s. That's about average, sometimes a little younger. Men are 1.5 times more likely to have Parkinson's than women, that's true. And about 100,000 people in the US have some kind of, are diagnosed before the age of 50, and that's where we classify the young onset Parkinson's disease. And that they tend to have somewhat of a different course, and that needs to be taken care of and looked at kind of more specifically. But the other estimates are, you know, somewhere around 1 in 100 of patients over the age of 60, of the population over the age of 60, develop Parkinson's disease at some point in their life. So it's not uncommon. So what increases your risk for Parkinson's? So if 1 in 100 or so over the age of 60 may develop Parkinson's, each of these factors, mostly in some of these environmental factors and exposure to pesticides, heavy metal solvents, air pollution, Agent Orange is a feature that's a linked recognized process in the VA. Traumatic brain injury, each of these increase your risk just a little bit, such that maybe, you know, 2 in 100 would get Parkinson's who have been clearly exposed to these things, not 100 out of 100, but you kind of had to have some predilection for this already. Age is a factor. As we get older, more patients are potentially going to pick up Parkinson's the longer you go into life. There's reasons for that, but into your 80s, you're more likely to have picked up some degree of Parkinson's than in your 60s. And then genetics, purely genetics cause, at our current estimate, at least as we know it now, about 10 to 15% of all Parkinson's, especially the young onset Parkinson's patients. And when we talk about genetics, again, that could be its own separate lecture, but you're talking about single gene mutations. That those you know, account for probably around 10% as best estimate as we can figure. So the combination of environment, yes, sure, lifestyle, and genes all impact the development of Parkinson's, but it's likely that there is, you know, that it's your genes, not a specific gene, but your genes in combination that predisposed you to developing Parkinson's, and maybe an environmental trigger kind of unlocked it. That's possible. So getting a diagnosis, and there's lots of early signs of Parkinson's disease, and they may or may not include tremor, small handwriting, micrographia, loss of sense of smell can happen even years before, trouble sleeping might happen years before. You may have trouble moving or walking, or maybe don't recognize that. Constipation can happen a few years before even Parkinson's. The first thing you might notice is that your voice is a little bit softer when you're not really trying to yell and enunciate. And then same with, you know, maybe a little bit of decreased spontaneous facial movements that you call fast masked face, or decreased blinking goes in that as well. Dizziness and fainting, as you said, Dr. Keurig is going to have a whole separate lecture on this, but really watching out for signs of standing up and having lightheadedness and feeling blood pressure drops, relative blood pressure drops. Sometimes that can happen a little bit before even the onset of your classical motor symptoms. And then maybe stooping, hunching over, that's not as common at the onset of Parkinson's, at the early diagnosis. And so diagnoses are often made by family physicians. But in our clinics, we often get patients sent to us, especially for the initial diagnosis. Specially trained neurologists called movement disorder specialists can help confirm diagnoses. So like myself, who did extra training beyond being a board certified neurologist, extra training to be a movement disorder specialist. Unfortunately, there's not so many of us. There needs to be more. But getting that diagnosis by a movement specialist is important because sometimes the early symptoms can be tricky. There is a brain scan that would be talked about kind of specific with each specific case, but there is a brain scan that can help with identifying those neurons that are dying off from dopamine loss. But sometimes the scan is not as good as two exams by a movement specialist. So that the scan is used in specific cases for the most part. So when coping with the diagnosis, there's a lot that I talk about with my patients, but giving yourself some time to process the news is important. Nothing is going to fall out in the middle of just all of a sudden overnight, and really take hold of knowledge, learning about research and treatment and lifestyle interventions. All the things that you can do to get on top of Parkinson's so that you own it and it doesn't own you, and make sure that you're looking in this day and age at reputable sites. And the Parkinson's Foundation website has so many resources for newly diagnosed patients looking for more information about research and treatment options and education. And then this last bullet point is so important, and we'll talk about it again and again, but each person's experience with Parkinson's is very unique. If you see somebody else in your neighborhood who has Parkinson's, they will have symptoms that you won't have, and you may have symptoms that they don't have. So be very cautious in projecting symptoms that you may have based on other people that you see. And there's a lot of different kinds and progressions in Parkinson's. So some people progress faster than others, and some people seem to minimally progress at all. And so try not to look into the future based on what you see in other people. That's very important. So what to expect? I don't have much time for these videos, but this is an example of videos where patients are talking, these are great, on the Parkinson Foundation, where we're talking about their individual journeys and specific conflicts that they had and obstacles that they overcome, spouses. There's lots of great testimonials, and you'll hear from some patients living with Parkinson's today as well. Symptoms do tend to worsen over time, and this says your doctor will monitor your progression at appointments, of course, and that no medications are proven to slow or stop disease progression yet. We're still working on it. Clinical trials, participation is so important. But the idea is that lifestyle modification absolutely can help. Exercise is very, very important. And as I'll say a little bit later, the goal is to modify medications. We have so many medication options to help your symptoms. The goal is to keep you exercising and keep you from doing the things that can slow down Parkinson's and enjoy as much of your life as possible. And sometimes you may progress, and we need to modify your medications as we go along. And that's a conversation and a relationship that you develop with your movement specialist. So this is a very common question, is when do I start treatment? So again, because medications do not specifically in and of themselves alter the disease progression, the brain progression of the disease, then withholding medications for a short time does not necessarily harm you. So if you're not ready to start medications, that's okay. There is a caveat to that though, and there has been research that if your motor symptoms are limiting your ability to fully exercise and have full range of motion, and fully participate in your social activities and work activities, then those patients who did delay, they don't always bounce back as easily when it's time to start medications. So there's a little bit of subtlety here, is that you don't have to start medications because it won't, clearly the medication won't change your disease. But if you're not able to exercise and participate in your full quality of life, that is the time to start medication, and medications help. So treatment depends on each person's symptoms and their personal needs. Exactly like we're saying, there is no hard fast rule, but don't be afraid of medications either. What else can I do to manage my symptoms? Yes, exercise we've talked about. So the best data that we have from multiple studies is that those who exercise can potentially slow the disease progression, and especially of motor symptoms, but also of cognitive symptoms potentially. So getting started with that is the most important thing you can do for yourself. Social support, healthy, well-balanced diets, and we'll talk more today about a support team of therapists and your own social networks is really important. So medications, again, so the medications, there's upwards of 20. I'll go over a couple of classes just for those who are new to this whole thing. But the idea is to replace the dopamine that your brain is missing, much like we need to replace thyroid when your body's not producing very much thyroid, or replace insulin for an insulin-dependent type 1 diabetic, let's say. So it is a replacement feature that can be very helpful. So the goal of treatment, again, is individualized, and that we're really trying to improve your movements, but also maybe there are features of attention span and multitasking and anxiety. There's also other features that dopamine does, not just movements, but we need to set those specific goals and use only as much medicine as you need to treat those. So there's basic medication classes. There are over 20 medications now in Parkinson's used in practice, and more are coming. It feels like every day there's been an explosion, especially in the last 5 years, of medications. Typically, levodopa is still the mainstay. That old Nobel Prize winning carbidopa-levodopa medication that converts into, it's a precursor of dopamine, and your brain converts it into dopamine as if it's its own dopamine. So it is not a synthetic. To contrast that, dopamine agonists are synthetic, and they act like dopamine in the brain. And there's advantages and disadvantages to using dopamine agonists. I personally do not like using them in many scenarios. It's rare that I use that class of medications. Levodopa replaces your brain's dopamine, and that tends to be mostly the backbone of treatment going forward. You may not start off there initially, but eventually levodopa tends to be the backbone, and then all of those other 20 medications are mostly medications that help the levodopa along, either staying around longer or help boost in other ways, or work on alternative pathways. But levodopa tends to be, carbidopa, levodopa, or Sinemet tends to be the backbone of treatment. And then the MAOB inhibitors and the COMT inhibitors both help the dopamine hang around in the brain longer, because eventually that can become an issue that we need to tackle. The last thing I added is the amantadine class of medications. The original amantadine is even older than Sinemet, but that is an advanced kind of class of medications that, if eventually, not everyone develops levodopa-induced dyskinesias, but sometimes when the brain is bathed back in dopamine as a side effect of feeling good and able to move and stand and run and coordinate movements, you can have extra wiggling movements as potentially a peak dose side effect. And the amantadine class is the class of medications that is the only one that had ever been proven to block those wiggly dyskinesias at your peak of the levodopa. So we would talk obviously individually about that, but those are the main classes. There's something important in here as well before talking about surgical options. This This is not the most common thing to talk about in a newly diagnosed group, but there's something specific in here. So tremor does not always play by the rules. Tremor in Parkinson's can be a little tricky. It's not a pure dopamine phenomena. So upwards of 50% of patients will get partial or no benefit from just replacing dopamine to their tremor. And that's important because people, it's important to know because it's common that other physicians might rapidly escalate your carbidopa levodopa to high doses to try and replace dopamine to combat that resting tremor, and you'll end up getting side effects before you get benefit. And so that's an important thing to know, is that about 50% of patients, tremor, the slowness, stiffness will respond. The walking ability, those features will respond. But the thing that might not respond is the tremor, and that's an important conversation to have. If the tremor becomes debilitating, the surgical option of something like deep brain stimulation or other brain surgical features are exquisitely helpful for tremor especially, as well as other symptoms like stiffness, slowness, and dystonia and other features. Just to make sure that we put all that on the table is that the one thing that newly diagnosed patients should understand is that if tremor is the biggest symptom that you have, and that is not being easily treated by medications, there are other options out there, but it doesn't mean that you don't have Parkinson's or that there's no hope. That's an important thing that I see missed by general neurologists frequently. So on this page, there are surgical options. This is a funny looking figure for deep brain stimulation, but that is something that I have particular specialty and training in. There are other features as well. There's Duopa pumps now. There's multiple non-pill adjuncts to medications besides the Duopa pump as well. Duopa is just carbidopa levodopa in gel form that goes directly into the small intestine. And then their focused ultrasound is a whole separate topic. But there are plenty of options. The main idea to take away from a newly diagnosed patient is that we have lots of tricks up our sleeve to help treat you. People with Parkinson's who seek expert care are at lower risk for complications and have better quality of life and live longer with Parkinson's disease. That's a bit of a self-serving statement for my sake, but I think it's accurate. I do see missteps frequently from people who don't see, from physicians who don't see Parkinson's patients all day, every day. This is what we do. This is what our passion is, and this is what we are very deeply invested in. So I do see missteps. Sometimes we all do in that respect. So build your care team. That may include a movement disorder specialist. Sometimes that includes a general neurologist as well, both if you have other conditions, but also someone who's much closer to you. If you don't have a movement specialist who's right next to you, frequently I have some patients who might see me 1 or 2 times a year, and I communicate with their general neurologist, who they also see 1 or 2 times a year, and we kind of share in communication. That takes a special communication and bond and relationship, but sometimes that's necessary if you can't travel far enough to see a movement specialist every time. And then nurse, physical therapist, occupational therapists absolutely become important, especially a good thing to get plugged in for in the early stages in Parkinson's. And then social workers, absolutely. There's tons of programs that they can help with. Psychiatrists, if you have mood issues that especially can come from Parkinson's, they don't have to at all. Many won't, but if you do, speak up and tell your neurologist. You may need a psychiatrist, a psychologist as well. For therapy is very effective. So all these things are great to build a care team of people who know how to help you. So in conclusion, Parkinson's disease is complicated. It's chronic, it's progressive. There are motor and non-motor symptoms. No 2 people with Parkinson's are the same. I can't emphasize that enough, is that many people won't develop many of the symptoms that we even talked about today. And, you know, you can't, it's sometimes difficult to even relate to other Parkinson's patients. Many times you'll say, oh yes, we're both going through the same thing, but there's many things that somebody else might be going through that you won't. A specialized team-based approach can help optimize quality of life for years to come. I agree with that. I think that there are missteps that you can do if you're not plugged in with specialty care. Ideally, especially at the outset, to get on a stable regimen that you're happy with, that keeps you working and doing all the things that you want to do. And then if you have breakthroughs or hit speed bumps, speak up and find somebody who knows their way around these things. And don't wait to take advantage of therapies and support services. That's very, very true. So I often get my Parkinson's patients plugged in very quickly with physical therapists and occupational therapists, especially who are trained in LSVT big, to get that basic infrastructure of exercises that you can continue at home for the entirety of your life, and always get back in at boot camp some for another session of that. But those are short-lived. Insurance doesn't pay for that very long, and those are short, dedicated boot camps to teach you those things. Then you pass the baton to other more sustainable exercise programs that you'll hear more about today, that are so important. I can't emphasize those enough. You will feel much better when you get plugged into those kind of exercise programs. And then there's plenty of things that you can take control of and live well with your Parkinson's. Talk with your support group, talk with your movement neurologist and everybody else in your group. There are lots of things that we can do for many symptoms if they happen to break through.
All right. Well, Dr. McLeod, thank you so much. I am going to ask you some questions if you don't mind, just to meet your time. I know you're seeing patients today. So again, we really are appreciative that you are here. And so why don't we just jump in? I'm going to ask you some of these questions I know you've seen because they were submitted early, but I'm going to ask you some ones that were submitted during the chat. And for those who haven't submitted your questions yet, please continue to do so. So here's a question we got today in the chat. The question is, what, and I'm probably going to botch this, you're going to have to fix it if I mispronounce something, but what goes awry in the PD-related anosmia, and explain what that is? Is it the brain cells or olfactory nerves? Are my olfactory nerves okay? That's the first part.
Yeah, I mean, to our knowledge, it is the olfactory nerves and the olfactory bulb itself. It is a really interesting topic of research. It also is something that occurs in Alzheimer's patients very consistently, and some other neurodegenerative diseases. It's pretty famously implicated in COVID as well, and it's something that we're trying to understand if there is a process that's transitioning from a peripheral process, and that's a marker of a neurodegenerative process starting to enter the brain, because sometimes anosmia occurs early. We're not 100% sure why. There's plenty of theories out there, but it is the olfactory nerve and the olfactory bulb as it connects, and that's kind of a connection between the nerves outside of the brain and the nerves that are coming into the brain. It's a bit of that connection.
And can levodopa help with the dying neurons?
No, sorry, no, it won't, and especially with the anosmia. I have some patients that. Yeah, that can be a tricky thing, and we don't have a good fix for that.
Okay. And this next question, and again, as you mentioned, and we mentioned a moment ago, we're going to do a whole program on dizziness and vertigo next week, actually, with Dr. Keurig. But this question is, what can be done for PD treatment when the primary symptom is dizziness?
Yeah, so determining what's causing the dizziness is the first thing. If this is a good time to have a big public service announcement about Parkinson's disease and blood pressure that is not well known enough in the medical community by your providers and to you yourselves, is that standing blood pressure, so dynamic blood pressure, when you're standing up, Parkinson's can affect your ability to squeeze for multiple reasons, to tighten your blood vessels, to then mobilize blood better, to increase your heart rate when you stand up, so that temporarily blood doesn't just pool in the legs like it does for all of us. So we all sometimes, if we're dehydrated and stand up quickly, we might feel a little lightheaded. A Parkinson's patient can get that even more significantly. And the tricky thing is sometimes it can be delayed upwards of 3 minutes or 5 minutes that you then feel down and dizzy. So the number one thing that happens in Parkinson's patients that's missed is, if you're feeling dizzy, check your blood pressure and slap it on and compare that to what your sitting resting blood pressures are, because it might be that if you start tracking those numbers, the easiest thing to do is that sometimes you need to come off of your blood pressure medicines. And then there's also a whole ton of information about how to mitigate blood pressure drops on the Parkinson's Foundation website called neurogenic orthostatic hypotension. But that's one of those sneaky things that my patients know I harp on all the time, but that's one of those sneaky things that just gets missed sometimes if it's there. So look out for that, and that's easily corrected, actually.
Great. And this next set of questions has to do with hallucinations. The first part of the question, well, first of all, does everybody experience hallucinations, over the course of their Parkinson's?
No, absolutely not. And it's I know, frustrating to see drug commercials and things like that when you're not experiencing hallucinations, and to think that that might be you, but no, absolutely not everyone will get hallucination.
And for those who are experiencing, hallucinations, are there medications that are effective in dealing with them?
Very, yes. So first of all, we need to make sure that you're not on medications, maybe from other physicians or from us, that can exacerbate, or that we could remove medications first. Sometimes that's the first step. Other times, sometimes adding just a basic entry medication, more like a donepezil and rivastigmine, that's not an antipsychotic medication, but can help with memory, thinking, insight, can help with hallucinations. And then finally, yes, there are medications that fit Parkinson's patients typically pretty well as far as getting on top of hallucinations, and ideally without much in the way of side effect. But yes, that's for most patients. There are several things that we can do about that.
That's great. This next question has to do with driving. And I know personally, I know my mom with Parkinson's, she stopped driving at night. I don't know if that was a Parkinson's thing or more of a cataract thing, I'm not sure, but what would you say are some sort of telltale signs that somebody with Parkinson's should probably stop driving, or at least talk to somebody about, handing over the keys, which I know can be really hard?
Yes, it can be hard, but you really need to think about your own safety and the safety of others on the road and safety of other people in the car. There are many pitfalls that a Parkinson's patient may encounter in having difficulty with driving. As Parkinson's symptoms progress, it's just not a disease that's very well suited for a task like driving, unfortunately. So signs may even just include difficulty, keeping up with multiple people in conversation. Attentional tasks is part of it. Even shifting eye movements can be somewhat difficult. And then, obviously reaction speed, especially at a complex intersection, if something is occurring, ability to recognize and react is something that, over time can be lost. A Parkinson's patient might not be their best task. So the biggest thing that I can say is, if there are family members who are driving with you, and they should be driving with you, most commonly we can avoid accidents if you're listening to them. If they see issues that may be cropping up, don't downplay what your family's telling you, because typically that's how we avoid an accident, is that they're the first line of defense. And then there are driving schools out there, some in Georgia, but especially in South Carolina. And sometimes a driving school can give you kind of tips and tricks, or find an issue that you're having that you didn't really know you're having. and they can get around it. Also, they can kind of certify you to say, you passed our tests. Here's a little, certificate to say that you passed these driving tests, so that if you do get in an accident, somebody can't just say, oh, you have Parkinson's, there you go, that was it. It's like, no, actually, I'm functioning quite well. So driving schools can cut both ways, and that would be a good thing to look into as well.
That's great. Well, we're just going to go through just a couple of additional questions, but, going back to kind of one of those things that you said, I know about the bottom not falling out overnight. I know when my mom was diagnosed, she had a pretty terrible experience, in one place, and then she went to another person, and she just, had a really good relationship with that neurologist. And so that's the one that she really stuck with. And one of the things that she heard, the only thing she heard, was the bottom's not going to fall out overnight. How important is it, for when you're talking to somebody, you're diagnosing them with Parkinson's, what are some of the things that you really want them to leave your office knowing, in addition to, obviously, you have this life-changing diagnosis, but what are some of the key takeaways that you always leave somebody with?
I mean, you're not alone, and we have almost an embarrassment at this point of treatment options, and things, if it's medications that you need or other surgical interventions or those things, we almost always have options, and really take stock and define what's important to you in your life, and tell us how and why you can't do that, because our expectation is that you can do all those things. I mean, our expectations now, I think when a Parkinson's patient leaves, is that, our expectations for your functioning are high. That's one of the things I think that I've seen not communicated properly, maybe for people who don't work with all the new classes and know Parkinson's inside and out, is that our expectations for functioning are high. That's important.
That's great. And, I know we talked a lot about exercise, and Martha Ann is actually going to touch on it again, because it's, it's so incredibly important. But, for somebody obviously with a movement disorder, how important would you say it is for them to really get in to see a physical therapist? If you're not currently exercising, would you say a physical therapist should be your first stop on sort of that exercise train?
Absolutely. Yeah. It's often a good first start, especially for people who aren't exercising, especially for newly diagnosed patients. I think I mentioned that the LSVT BIG program, there are Parkinson's certified physical therapists who are specifically trained and certified to work with Parkinson's patients on specific issues that Parkinson's patients have. And the type of training, it's kind of a boot camp, 16 sessions is the classic boot camp for Parkinson's. And that's so important. The skills that you learn in there, you can take forward for years and years and years, and you can always re-up it and do it again and do that boot camp again. But it's a good place to start then getting into your exercise routine, is they'll teach you how to be safe and how to, really explore what range of motion and those kind of features you should be doing to help your joints and long-term longevity. And then you get into your exercise routine. But it's a great place to kickstart. I agree. Physical therapy is a great place to start.
And then we'll just do kind of one more question. And I know we didn't really get into sleep too much, and issues, but certainly people with Parkinson's can have some issues sleeping, REM sleep disorder and a variety of other things. But somebody asked in the chat, how she can address nightmares specifically. I don't know if that's something with Parkinson's
Yeah, it is. I mean, a Parkinson's patient can have multiple issues with sleep. One of the most common is a little bit of middle insomnia, sleep fractionation. So the middle of sleep can be somewhat disrupted. And then, yes, there are REM behavior disorders. So punching, kicking, talking out dreams often can start years before the onset or diagnosis of Parkinson's. REM behavior disorder gets kind of a bad rap, unless it's bad and excessive, it's usually in your deepest time for sleep. And it isn't commonly disruptive for sleep unless your spouse tells you or somebody tells you. Specifically with nightmares is that dreams can get more vivid in Parkinson's, even before sometimes the diagnosis is that dreams can be more vivid, for better or worse, and sometimes you can get nightmares. You do need to watch out that some medications taken closer to bedtime can augment nightmares a little bit. So sometimes removal of some things in some specific patients can help. And then the opposite is true too. So there are ways to kind of suppress the REM cycle if we really need to. And so there would be medications that we could modify that a little bit sometimes. But I have had cases where nightmares are a tricky thing to get on top of, even despite a couple tweaks.
Well, thank you so much, Dr. McLeod, for your time today. That's all the time we have for questions, but I so appreciate you being here and appreciate what you do for people with Parkinson's, because I think, I've seen firsthand, getting a diagnosis of Parkinson's can be tough. So many things, right, that we can do to, to live well with this. And that involves finding a really great neurologist, a really great movement disorder specialist. I would say one of the positives, if there are any with COVID, is that I think a lot of people are now moving toward this telemedicine approach. So even if you live in an area where you don't have a Dr. McLeod, right down the street, or another expert, chances are, if you call our toll-free helpline at the foundation, we can try to connect you with an expert, a specialist via telemedicine, because like you said, no two people with Parkinson's are the same. And there's so many, complexities that go along with this journey. And so having a really good care team is very important. So
yes, agreed. I've been trying to see, I do see several patients that live far away. We try and split up telemedicine visits. I would just say, make sure, even at the highest level, make sure that your congressman and senator and the state of Georgia actually has done a great job, but that they make insurance companies reimburse so that the hospital will allow me to do that. I would love to do that for patients, to not have to travel 4 hours in a day to see me. That would be amazing. I will do it all day long as the hospital lets me.
That's great. Well, and I think that's really important. We should all, getting a diagnosis of Parkinson's, you can get involved, you can become an advocate, you can become a volunteer. I think that's really important. And the Parkinson's Foundation has a lot of opportunities for you to get involved and become research advocates, or, whatever that. So thank you, Dr. McLeod. We really appreciate your time. Now we are going to switch gears and we're going to get you guys up and moving for a few minutes. So it's my pleasure to introduce Jeff. Jeff has, since 2016, Jeff has been coaching boxing for Parkinson's through the Livermeno Delgado Boxing Foundation in Sandy Springs, Georgia. In addition to his Parkinson's specific training, Jeff is also certified as a USA boxing coach and is an MMA striking coach. So the LDBF Boxing for Parkinson's program, where Jeff teaches, offers both in-person and virtual boxing classes, yoga, and more. So for more information and to join a class, you can visit boxingforparkinsons.org. So without further ado, we're going to get Jeff up here on the screen. See if we can find Jeff. And again, Dr. McLeod, thank you so much for your time. All right, Jeff, there you are. Well, thank you so much. Well, Jeff, we'll let you take it away here for the next 10 minutes. So thanks.
That sounds good. All right, so I'm Jeff. I trained fighters in the Army for 12 years. So then I started doing this. This is definitely different from what I normally do. I own a boxing gym, but I'm just going to kind of show you how we do a little bit of a warm-up, give you a couple exercises, and then we'll do a little bit of a cool down on the span of about 10 minutes to kind of give you an idea of what we do specifically for people with Parkinson's who are early onset. So usually we start off with a little bit of a warm-up. So we just sit here and we like to work on all the different things that have to do with motion. So I usually start off doing some neck rotations, and then we move to shoulder rotations, right? Usually 5 to 7 in each direction. Really just to kind of get the blood flowing, and then some arm rotations. And then turn the body a little bit. All right, and we take our hands out to the side. Ugh. Good. Now we're going to bring our elbows to our knees to our elbows. Good. Now we'll jog in place here for a little bit. And now we'll do some jumping jacks, or we'll do a modified jumping jack. We'll step out to both sides. Kind of depending on your comfort level. All right, good. So that's kind of usually how we run the warm-up. We do about 10 minutes of warm-up typically per class. Then we start off with doing the boxing portion, where usually about 20 to 30 minutes, kind of depending on the day, where we are in the training cycle. So usually we'll get into position and then we'll practice throwing combinations virtually. We don't use a bag, so we do it very much like we're doing it right now. And then for the on-site courses, we actually have them in front of one of the bag farms. And so usually what we'll do is we'll work on developing offense and defense, usually concurrently. So we'll throw combinations. So I'll usually give a combination like 1, 2, 3, 2, 2, 3, 2, and then have the participants of the class will do that usually for between 2 and 3 minutes. And then I'll go through the class looking over how everybody's doing the combinations, and then I'll critique them based off the mechanical and other types of form-based issues that may come about, right? So we start off, I'd say combination like 1, 2, 3, 2. So 1, 2, 3, 2. Do that for about 2 minutes. I come up with another combination like 1, 2, 5, 4. 1, 2, 5, 4. Other combinations we kind of use to break up. So we'll do like a syncopated rhythm. So they'll have to throw, the punches might be 1, 2, 1, 2, but they got to throw in a different rhythm every time they do it. So it'll be 1, 2, 1, 2, or it'll be 1, 2, 1, 2. And we try to change the rhythm, right? Because we want to exercise the temporal senses of the brain. So you throw the 1, 2, 1, 2 in the different syncopated rhythm, and then we'll kind of integrate offense, we'll integrate the defensive maneuvers with the offense. So we'll throw 1, 2, slip, 2, 1, 2, slip, 2. And then we'll actually get lateral movement involved, and they'll practice combinations on the move. Sometimes we march in formation, where we'll have everybody get into a group, socially distanced, of course, in this age of COVID. And then we'll do a pre-programmed series of movements. So we'll say 1, 1, 2, 1, 1, 2, 1, 1, 2. Once we get through the boxing portion where we've practiced throwing all of our different combinations, then usually we'll do more specific exercises that have to do with balance, coordination, and other things. So one of the ones that we do is people will take a tennis ball and walk usually around a series of cones laid out in either a serpentine pattern or in a box, and they'll have to trace the edge of the box while bouncing a ball, and they'll go the opposite direction, do it with the other hand. Some of the other things we'll do is we'll work on deliberately compromising balance so that people can work on their recovery. So we'll put them on very uneven ground next to a wall, of course, and then we'll have them step either on their toes, or we'll have them slightly squatted, and then force them to navigate difficult terrain while they have the ability to support themselves, but while trying to get them to work on being able to traverse difficult terrain. Then we get to more of the fun stuff that I like to do, and I'm going to give you a demonstration of that. So we'll sit here and we'll throw combinations. So we're going to say the combination is 1, 2, 5, 2. And now what we're going to do is we're going to come up with as many words that start with the letter T as we can while we do it. We're going to do it for 2 minutes. So it's going to be 1, 2, 5, 2. And now we're going to say, starting like right now. All right. So 1, 2, 5, 2. Tango. 1, 2, 5, 2. Terrain. 1, 2, 5, 2. Torrent. 1, 2, 5, 2. Travail. 1, 2, 5, 2. Traverse. 1, 2, 5, 2. Terrible. 1, 2, 5, 2. Torrential. 1, 2, 5, 2. Torrento. 1, 2, 5, 2. Torrentum. 1, 2, 5, 2. And that kind of gives you a good idea of how those exercises go. So we usually do around 3 per class where they'll take a different letter and they'll work on coming up with words. You know, it's all about trying to have people use the innovative parts of their brain where they have to come up with something, not necessarily by memory. And then we'll do counting exercises where they'll count down, like the really hard ones, like if I'm feeling some type of way when I'm starting the class, I'll have to count down from 179 by 16s, which is not easy. I'm not a mathematician, so that's not easy for me anyway. I'm a historian. And then from there, I also give long-term memory exercises. So at the beginning of the class, I'll say, all right, 100 BC, the birth of Julius Caesar. 509, the birth of the Roman Republic. 753 BC, the beginning of the Roman kingdoms. And I'll make these people memorize these dates in the beginning of the class, and then they have to do the class, do all the training, and then at the end of it, they have to recite to me both the date and the event that was important. You know, for me, I'm a military historian, so it's battles or people's births or deaths or whatever. So the approach is holistic, daily, and then also weekly. I try to integrate different exercises that reflect different functions of the brain, and then we just do them cyclically, and then I change the order every month because the idea is that we always want to be engaging the idea of neuroplasticity. So I'm not just going to give you the same order of events every single time we do it, because innovation is a big part of what the brain does, and if you're going to exercise the faculties of the brain, you should do it in an innovative fashion. So really, like and then our cool downs usually will kind of start like when we ended the cool down, we were doing a lot of jogging and a lot of jumping jacks. So we kind of start the cool down from that position, doing our little jog, doing our jumping jacks, right? And then we'll get to the point where we'll go back to our rotations. And then ultimately we'll go into just a little bit of light static stretching, just to try to make the gains in mobility last as long as possible. And then usually that's about it. And then try to conduct an after action review after every class to figure out which parts of the class we liked, which parts of the class we didn't like as much. Usually from the participants, so that we can have a better product every time we do it. And that kind of sums up like our approach. If you have any questions, you can email me or Denise Formazano. I'm sure she's in the email traffic for this. Anyway, I appreciate your attention, and I think that's all I've got.
Thank you so much, Jeff. That was awesome. And yes, I will share in the follow-up email for you guys. I will share information again about the LWF Boxing for Parkinson's program. And I know Kathy mentioned in the chat, there's another great boxing program in the Augusta area. So yeah, they're fitness programs, you know, kind of all over the place, but you know, I know this program well. They've been around doing what they do for a long time and doing it well. So thanks, Jeff.
Thank you.
Today. I hope some of you guys enjoyed boxing. So now we're going to switch gears. Now that we've all gotten up to move around a little bit, we're going to go ahead and hand things over to our next presenter, Martha Ann. So I'm going to introduce Martha Ann. She is one of my favorite people to work with. I've gotten to know her well over the last few months. Martha Ann is the center coordinator and a licensed associate professional counselor in the movement disorders program at the Medical College of Georgia at Augusta University. Before joining the movement disorders program, Martha Ann was a nationally recognized journalist. With a love of listening to individual stories, she uses a strength-based approach to help others take control of their narratives with confidence, resilience, and a sense of humor. She's blown away every day by the courage and positivity of the patients and the families that she serves. She specializes in trauma and loss, providing insight and direction for turning unwanted changes into opportunities for growth. Very well said, Martha Ann. Thank you so much for being here. So I'm going to kick things over to you.
Okay, thank you so much for having me. Thank you for everybody today that took your time for what else you could be doing to spend with us here. I think as Annie commented, this will be recorded, so if anybody missed it or wanted to use it in another setting, I know that would be great and something that Dr. McLeod and I would love to happen, and so feel free with that. And thank you, Annie, again for having us and coming up with just one of these great programs after another. It's a little mind-blowing to me, the amount of material now that's out there on every kind of topic. I'm going to do my screen sharing now and hope that I can do that. Yeah, I think I figured that out. And so in Dr. McLeod's talk, you know, he touched a lot on the more medical type aspects. I haven't been to medical school, but we worked together on the same team to address sort of a holistic approach for what it is to live well with Parkinson's disease or care for someone who is living with Parkinson's disease. And one thing that the Parkinson Foundation does at every turn is, while being very direct and forthcoming with the disease, the fact that at this time we cannot offer a cure, but they frame everything in realistic hope, because we do know that while we cannot offer a cure at this time, we do have a great many interventions and lifestyle changes and things that an individual can do for themselves that truly makes enormous difference in their quality of life and the quality of life for those around them. And I know that you may be aware, certainly in the news, about longtime Senator Johnny Isakson from Georgia, who had to retire before the end of his term because of a long battle with Parkinson's. And this is a recent quote from Senator Isakson, that with Parkinson's, you have two choices. You can let it control you, or you can control it. And I've chosen to control it. I love this statement from him because, you know, I think for all of us now, especially in this COVID world, we can feel that we have no control, that the world is out of control, that we're sitting here, just bad things are happening to us, and we're sort of powerless to do a thing about it. Getting a big diagnosis of a degenerative, progressive disease or condition can certainly make a person be left with the feeling that I have no control, I've lost control, this isn't something that I asked for. But the truth is that there is so much that you can control and that we can control. And part of that is just to remind each other of that, and the things that we can do starting now that can make a huge difference. So I'm going to go over some slides and go over them somewhat. They're going to serve as kind of a framework. At the end of this, I have the honor of serving with some patients and care partners on a panel. So if you have any questions, that would be a good time to ask them. And you can ask me, or I can chime in with somebody else's answer or whatever, but it all gets to that team approach. So we're talking about what's most important to you here to start off with. And, one of the first things that I say to a newly diagnosed person with Parkinson's is, you're still you. You haven't now changed your name or your purpose in life and become Parkinson's patient. You're still you. And with your personality, your life, your goals, those that you hold dear, whatever it is that gives your life purpose, and how can we all work together to help you still live your life to the highest quality that you can. So these are questions, what helps me live better today? What helps me live better in the now? And that's what all of this is about when we talk about the control that you still have. And as Dr. McLeod said, no two people really have the same journey with Parkinson's. No two have the same outcome, and that you do have power at a time when we might need to be reminded, because it can feel like we don't. So some of the things about living your best life, which is the newest publication from the Parkinson's Foundation, and I'm going to talk about that in a minute. But as we said, you're in control. Parkinson's isn't in control. This is one more thing on your plate, just like other things you already have on your plate that make life challenging, that are things to adapt to, that have to be taken into consideration, but you're still you and you are in control. And find the right care providers. Again, Dr. McLeod talked about the importance of having a diagnosis from a movement disorder specialist. The Parkinson Foundation's helpline, which we will put up, Danielle will put that up in a little bit, and we'll talk about that later. That's another example of a question for the helpline. If you don't know of a center of excellence or a movement disorder specialist near you, they can help you find one. And as he said, these are board certified neurologists who, after residency, went ahead and did a fellowship specifically in movement disorders. So I see this a lot in our program. Even neurologists, they can say, I think this is a movement disorder, but when they send them to our specialists, they no more say the atypical presentations, all the other related diagnoses that may not be so common or may not be so commonly known. And it can just be a really wise step to get a diagnosis from someone who is a specialist. Exercise, we'll talk about that in a minute. I think we've hammered that home already today, the importance of exercise, and I'm going to talk a little more about that too. The importance of those medications being taken as the doctor prescribes is really important. Support system. I know in the individuals whom I work with who are living with Parkinson's do so much better when they have a support system, when they don't try to do it alone. It's a time for, reaching out. Support groups, Parkinson's support groups work for some. Some people enjoy those more than others. Some people are more extroverts. Some people are more introverts. Support groups vary from one location to the other, but they have a lot of benefits. And even if you are not near a support group now, I think they're all offering virtual formats, but just that support group, whether for you that is, you know, your place of faith that you worship, whether it is your neighborhood, your friend group, your workplace, your family, whatever that is, support groups are important. And we have Flexible here, which is not meant to be part of the exercise program, but that flexibility matters too. But by Flexible here is talking more about, you know, the rugs that have been pulled out of all of us with COVID, for example, but also by something like a diagnosis like this, where, you know, maybe you were getting your exercise one way, or maybe you were getting a support group. You have seen your support group one way. Emotional support came to you through, you know, weekly coffee gatherings with friends or something that's not doable right now. So be flexible. And one thing that is we work on is how can we still meet these goals and these needs, but maybe do it a little differently than we have been doing it. And maybe we need to do it different from now on, or maybe that's temporary, but the flexibility to do things a different way. Stay connected and engaged. Your attitude really matters. And this is something that we do control, and you can make literally incredible difference, all the difference in the world and your quality of life by these things that we've just talked about, every one of which is something that you can choose to do. And I'm going to talk a little more about attitude in a little bit. And this is just what we were talking about with your personal goals, because this is your personal journey. And you go to the doctor and they're giving you advice, but you're still in control with what your priorities are and how you want to go about doing these. You know, you want to go about taking care of yourself and putting some of these interventions to use in your personal life, in wherever you are in your setting. So I want to start exercising and connect with others and get more sleep. So these are all interventions that we'll talk about in a minute that can make a huge difference. And we all need these things, but when you have Parkinson's or something similar to Parkinson's, they matter more. So, you know, not getting a great sleep isn't great for any of us. It can set us all kind of sideways, but when you have something like Parkinson's, the effects of, say, not getting good sleep can be harsher. And so it's even all the more important to sleep, good sleep, eat well, take care of yourself, exercise. This is a book I mentioned a minute ago. And this Parkinson.org website, also, which Dr. McLeod mentioned, is just a treasure trove of information. They have a great search bar, and everything they have on there is free and downloadable. So you can download anything in this. This is a book when you see it about this thick, and you can download anything in there. You can read through it online. It's going to be coming on Kindle soon. But you also can, as a Parkinson patient, you can go online and order one copy of a thing and the hard copy that will be mailed to you. So when we talk about finding someone you can talk to, this gets back to that support group. You're not alone, and you're not alone if you don't choose to be. With Parkinson's, there are a lot of the symptoms that can cause people to want to withdraw. I hear people say, you know, I have a tremor, or I don't walk as easily as I did, or sometimes when I drink my water, it can spill a little bit, and this is embarrassing, and I no longer want to go out, and I'd rather just stay home. And we know that apathy is a very common symptom in Parkinson's. So having a buddy, someone, a cheerleader, someone that you can talk to where you feel safe and you can say, I don't feel like getting out, or I'm feeling sad today, or I'm I'm down today. It's very important. It's completely normal to have those times. I don't know anyone who doesn't, let alone a Parkinson's patient. But it's important for emotional health to stay connected and to have friends where you can talk about things other than Parkinson's too. So again, we're just encouraging everyone, especially now in COVID, when it's even harder to stay connected sometimes. Family may not come over. We just had Thanksgiving. Maybe that looked different for you than before. Family, grandchildren don't come as much. I have many patients who have had some real disappointments with these. They understand why, but it's a sacrifice. Getting out with groups, going to church or synagogue or temple is not something that may even be an option because of COVID. So it's being flexible and resourceful, availing ourselves of the options like this program today that probably would have been in person if it happened before COVID. So staying in touch the ways that we can, and to remember the importance of that. So to prioritize it. The Care and Coping is a book that is really something I have found care partners to get a lot of value from. They need support as well, and they need all these interventions too, with the eating right and sleeping right and getting exercise. And this is another one of those publications I told you about that will be coming to Kindle, that you can go read right now on parkinson.org by downloading, or you can ask for her copy to be mailed to you. There also are resources for care partners on this parkinson.org site. Other than this, lots of podcasts, presentations like this, links to research, links to articles, lots of resources to support care partners, because that is a very demanding position for them and so important. So they need our support and understanding very, very much. We talk a little bit about the control we can do in creating healthy habits, and I've touched on this already with sleep and foods. These are just things that can make a huge difference. And some of the things that we know about nutrition with people who are living with Parkinson's is that the nutrition is important. Sometimes some food can interfere with some medication absorption. So it's important to ask doctors about this with whatever medication you might be on, if you are a person living with Parkinson's, or if you're caring for someone who is, about their medications. So good nutrition can help your medicines be more effective. The balanced diet is important. Herbs are important. Drinking that water is important. Limiting sugar intake can help with inflammation issues. And is there a Parkinson diet? I've heard this question before, and the answer is not really. There is some studies that are indicating that people who have a Mediterranean diet may have a lower risk for developing Parkinson's. And that's unknown, and those are just indications. But as far as once a person has Parkinson's, there really doesn't seem to be a lot of research showing that the Mediterranean diet or another diet seems to be better or not. But most medical offices or programs have registered dietitians, and certainly your doctor, your neurologist, your movement specialist would be able to help you with knowing the medicines that you're on and what you can do, and just to eat healthy for all kinds of reasons. So these are some that I just put up here to be examples of foods that we're talking about, and they're all good, like walnuts and pistachios and macadamia nuts. We talked about herbs, so we've got cinnamon, rosemary, and the anti-inflammatories. So dark leafy green vegetables, salmon and tuna and other oily fishes, coconut oil, And then antioxidants, which is, blueberries, raspberries, green tea. So hopefully you're already eating a lot of that good stuff anyway. And the good night's sleep, I do even whole workshops on sleep hygiene. It's so important. It's really just hard to do much of anything when you are sleep deprived. And again, when you are someone with Parkinson's, these sleep troubles can take a bigger toll, and they can seem to affect you more than maybe they would somebody who wasn't dealing with Parkinson's. And then, of course, you see how that affects the care partner, because if one person isn't sleeping well, the other one probably isn't either. So routines, waking up and going to bed at the same time, not taking big, long naps. And then again, every list that you see about good, you're going to see exercise on there, but most people feel like they sleep better if they didn't exercise right before they went to bed, because it sort of gets them just going and it's hard to settle down. And most people feel that avoiding caffeine later in the day is a good idea and helps them sleep better. And being outside, which you'll hear me talk about again, it's so important to get outside. This is a slide actually Dr. McLeod went over, and I'm not going to stay on it except to just reiterate, even 30 minutes a day for 5 days a week can have impact positively on people living with Parkinson's, and has been shown to slow the decline in the quality of life and to slow the progression of the disease. And that's what Dr. McLeod was talking about. It seems to be more effective than the medicines, more effective than anything else we can do, that exercise. And as little as 2.5 hours a week, you can divide that up any way you want, 30 minutes a day for 5 days. And there is just no end to the good news about exercise. Not only about mobility, balance, these activities of daily living, helping slow the progression of this disease, but also emotionally, psychologically, and mentally. So we know from research that getting outside, exercising, moving your body is greatly associated with reduced anxiety, with reduced stress. It helps with depression. And we also have research showing that getting outside helps a little more than being inside if it's a possible option for you. Just the color green. There's something about being outside that helps one live in the moment. The sounds that you're hearing, the breeze that you're feeling, the colors that you're seeing, you're noticing textures. These are very centering and help us not worry and get out of maybe some worry loops that can start about the what ifs and what about when. I don't think it really matters much what exercise you do as far as the benefits. Moving your body in any way helps, period. We do know that with Parkinson's, there have been studies showing particularly things like the boxing that's been mentioned, Tai Chi, and yoga. There are some dance programs starting with boxing. These have been shown to be even more impactful for the particular issues that are going on in a Parkinson's situation. And now so Dr. McLeod also had this slide and spoke to that exercise really has been associated with more brain resiliency, neuroplasticity. And again, every time they study exercise, it impacts everything positively. So just keep moving. And when we talked about the flexibility, if your current program isn't working, if your current program isn't being offered, if you feel like it's getting to be a little too much, or it's boring, or you can't keep up, that doesn't really matter. The intensity of it doesn't really matter. It's the doing it and doing it every day, or doing it 5 days a week. That's what's making the impact. Just make it be part of your routine. If you're someone who can't really get up and do like a lot of exercises, just standing up and sitting down, walking from one room to the other. If you're in a wheelchair, you can do chair exercises. You can just go sit outside on the patio. These are all things that may seem very simple, but have surprisingly large positive impact. So we'd already talked about this a minute ago about finding a specialist, so I'm not going to stay on that. And how you can go to this helpline down here, the 4PD info. If you go to parkinson.org, the helpline is very much broadcast on that page as well. And this is where you can get bilingual assistance from Parkinson's professionals who can answer many, many questions and also steer you to resources. So it's not just for how to find a specialist, but for all kinds of issues. The helpline is a phenomenal resource. Dr. McLeod also talked about these key questions, but the part I wanted to point out about this page is this newly diagnosed kit. So you can go to parkinson.org and access this newly diagnosed kit, which has a folder, which has some information in it, like this one about key questions for your doctor's visit, that are just great to have when you're dealing with a new diagnosis. Again, this is free. They will mail it to you in the mail if you ask, but you also can download it. And these these are easily shared with your loved ones, no matter where they're living or what they're doing. So I do recommend that newly diagnosed kit. And as the mental health counselor in the program, I have to talk about mental health because we know, again, how important mental health is when dealing with Parkinson's. And depression, anxiety, apathy, these are very, very common. We know that at least 50% of individuals diagnosed with Parkinson's will experience depression. And that's even includes people who did not have a battle with depression before their diagnosis. And up to 40% will experience some type of anxiety issue or disorder. And these are more common in folks down the road who have been living with Parkinson's for more than a decade. We also know that almost half don't get any treatment. And male patients are more likely to not get mental health treatment. And there can be a lot of thoughts as to why. Nobody really knows, but maybe, not knowing that that this even is part of Parkinson's. There are real chemical changes in a Parkinson patient's brain that create depression. I've had patients say to me, am I just, do I just need to snap out of it? Am I just having a bad attitude? Am I just, feeling sorry for myself? And the answer is no. And there is help available as well, which is the good news. But to recognize these and that they can, anxiety and depression can really take out your quality of life in a big hurry, and not just for you, but for anyone in your life. And so it's good to recognize and to realize and to, at the get-go, that if this starts happening, if I start feeling depressed, ask a family member, do you see a change in me? Do you feel like that, that I'm getting sad? Do you feel like that I'm worrying more? Because you may not be a good judge of that for yourself. So just to know that that's very, very normal. And this massive Parkinson's Outcome Project study, again, that Dr. McLeod referred to, and you will see mentioned many times in any Parkinson Foundation materials, because it's just the source of all kinds of information, insights. Mood, depression, and anxiety, when taken together, have the greatest impact on health for a person with Parkinson's, even greater impact than their motor impairments. So this is a big deal. And I think it's something that a lot of people don't know. I think there's a lot of misunderstanding about that. As Dr. McLeod said, people tend to talk about tremors. They think of Parkinson's with a tremor, and not all Parkinson's patients even have a tremor, but I find patients surprised when I say, oh, mood and depression and anxiety, apathy, this is all part of it. So that can be validating and freeing. And then the good news, as we said, is we know some things that really make a big difference and really work. So exercise, movement, as we've talked about, counseling, having a safe environment where you can talk to someone about how you feel. You may have heard of cognitive behavior therapy. It's a standard in counseling and psychotherapy. It's sort of also called talk therapy. There's research to show that that is particularly effective with Parkinson's patients. And in fact, there's an entire protocol that's been developed at Rutgers University for modifying cognitive behavior therapy for Parkinson's patients and care partners. Connection to other people is so important. Humor is hugely resilient. Find a way to laugh, getting outside, spirituality, whatever that is, research shows that folks who have a spirituality, do better. It frames your experience in purpose, the sense that there's a higher power who listens. It's associated with people having a much higher quality of life and doing much better when it comes to mood and depression and anxiety. Routine helps. These days with COVID, the days can just melt one into the other. So you may have to make a routine. You may have to say, I'm going to get up at a certain hour. We're going to eat at this time. We're going to have exercise class at this time. It might be virtual. We're going to have dinner at this time. Music in the home helps. I have one couple with Parkinson's, and the man told me that the woman has Parkinson's, he's the care partner, and every afternoon they go to different parts of the house and read a book or do something different from each other and come back together in the kitchen at night, put on music and have a slow dance in the kitchen while they're making dinner. I just think that's brilliant. He didn't even know what he was doing when he did it, but that hits so many things that are just so reinforcing of good mental health and closeness. And then your goals, hobbies, and interests. You're still you still have them. If you like to paint, you like to garden, you like to listen to music, you like to compose music, you like animals, whatever it is, there's certainly a lot of offerings now virtually, and it's important to keep those up because you're still you and just find out what works best for you. So again, just these next steps that we are reiterating. And this is going to be available again at the end, but that helpline, enormous resource, the newly diagnosed kit that you can order, and also this Aware and Care kit, which is gives you a lot of information, sort of what to happen if you have to go in the hospital when you have Parkinson's and other topics. So this also can be downloaded on the website or ordered for a small shipping fee. And in conclusion, we're dealing with something that's complex, more complex than you might realize. As we talk about, it's not just a tremor, there's all the psychosocial impact as well. And no two people are the same. It's a holistic approach, so add people to your team that support your support group, whatever that is for you, a mental health counselor, physical therapist, occupational therapists, social worker, movement disorder specialist, whatever it is that you need, just to know it's a team approach. Don't try to do it alone. You're not alone. And there are a lot of therapies and services that we know can make a huge difference. So this is the end of my part, and I think that we're going to go into the panel session now. So if you have any questions, I'd love to know them.
Thank you so much, Martha Ann. That was fantastic and informative. So we really appreciate it, and I think it was helpful to reiterate some of the information Dr. McLeod covered, because things like exercise and sleep and nutrition, I think we can talk round and round about how important those things are, but in Parkinson's, they really, really can make a big difference.
Yep.
Now we're going to jump into our panel session. So I'm going to have Cheryl, who's going to be, she's one of our panelists today. I'm going to put her on the spot here. Cheryl, I'd love for you to just briefly introduce yourself, your connection to Parkinson's, and then I've got a couple of questions for you, if you don't mind.
I was diagnosed 8 years ago when I was 68 years old, and it was a total shock. I had noticed a slight tremor as I walked upstairs, and a tremor in my right hand, and my internist, is super cautious, said, we'll get it checked. And boy, did I learn so much about Parkinson's, because I had never understood the non-motor symptoms of Parkinson's, the loss of smell, the talking in sleep, the nightmares, the small cramped handwriting, that I didn't swing my right arm. So it was a revelation to me, and an opportunity for lots of education. I was faithful to the rainbow books, we called them then, but now the publications that you've talked about that are available would incorporate the same kind of things I found in the rainbow books. And one of the best pieces of advice I got was from my brother, as a doctor. He said, find a therapist or trainer to devise a program for you to exercise all of your muscle groups. And I did that. And I had routinely exercised. I probably was doing 10 or more hours a week between combinations of the gym, water aerobics, walking. And then I discovered yoga. I have a great class for yoga. I loved classes. I loved the fun, the socializing, and the routine that it established, that you had to be there on a certain day and a certain time.
Thank you, Cheryl, for introducing yourself. And I'm gonna just ask you a couple of questions, that I think a lot of people in our audience today can probably relate to. But Cheryl, how is becoming, I know, unfortunately your husband has been sick as of late, and he's, needed your support. So how has becoming a full-time care partner for your husband changed your self-care routine, when it comes to your Parkinson's?
I realize now how fortunate I was to have the time, energy, and resources to take care of myself. And all of that changed in March with a double whammy. My husband was diagnosed with cerebral amyloid angiopathy, and I became his full-time care partner, as well as COVID. So it shut down my classes and support groups. I'm lucky that our yoga has, because it's a small class and we can wear masks, has started back, and I'm trying my best to put that back in a routine, but I found that it became almost impossible to control my own time. So that's truly a battle for me now, in trying to do what I have to do in caring for my husband and running a household and managing finances and trying to take care of myself.
Yeah, and I think, one thing that I really appreciate, Cheryl, about your story is that it's, you are, like you said, you knew what it was like to full-time be able to take care of yourself, and now you're having to take care of yourself kind of on the side. So in addition to, I know you said your yoga classes started up. I mean, are there sort of tips that you could provide to other people who are in your situation, who are, dealing with Parkinson's, but then also caring for loved ones? Any advice you can give to them?
I am forging that road as we speak, and I certainly have no pat answers. The most difficult time for me is the ability to control what happens in a day. And at this point in time, I don't have the ability to control it, so I have to adapt as best I can. But walking, I can fit in almost any time. The classes, there's set times, so you can look to virtual if you're disciplined enough to have a space and time that you can do that. it's a learning curve for me, and I am still trying to find those answers.
Well, Cheryl, thank you so much for your transparency and your honesty today. And I know that you are in good hands over there at the Medical College of Georgia. So I'm glad that you have access to that kind of specialized care. So thank you, Cheryl. We're going to introduce another panelist, and Cheryl, we may come back to you with another question in a moment. So thank you so much for sharing. Next, I want to introduce our next panelists I've known for a long time. I've had the pleasure of knowing for a long time, and that's Larry and Ellie Kahn. So, hey guys, these are very familiar faces in the Metro Atlanta area and beyond. But Larry and Ellie, I'd love for you guys to just, briefly introduce yourselves, and then I've got a few questions for you guys.
Sure. Elle and I were making retirement plans when I was diagnosed with PD 10 years ago at age 50. My neurologist said medication could mask the symptoms for a few years, but nothing could slow my steady decline into disability.
We were devastated. We cried a lot for a few days, grieving the loss of expectations for a long and active treatment. I'd like to just add something to all our speakers. They're wonderful. A lot of the things that are mentioned are so thorough. Thank you. They really do work, as you'll hear us kind of reiterate some of that, but why we do some of those things.
Anyway, back to the beginning of our story. I just went back to doing what I was doing, researching my third novel. I wasn't depressed, just doing what the doc told me I could do to help myself, which was absolutely nothing. Usually I'd throw an F-bomb out right around there. Fortunately, Ellie did not give up so easily.
After about a year and a half of sharing my research notes and waiting until Larry was ready, I convinced him to attend a local PD support group. It was purely coincidence that the featured speakers at the meeting truly changed our lives.
The focus of that meeting was the benefit of exercise on PD, which everybody has been talking about today. But back then it was new. Two instructors were waving around a study that showed Tai Chi could slow disease progression, and they were offering a free workshop for our group. Two physical therapists were touting research that vigorous exercise could also slow the disease progression. I dove into the exercise and research and reshaped my outlook toward this disease. It felt like I had taken back some control, and we continue to follow a hopeful, proactive approach that really works for us.
Thank you guys so much. And you've already covered sort of some of the information I was going to ask you, but Ellie, I'll ask you first. As a wife and a care partner and a mother, how has your role as a care partner changed over time, and has it changed? And what advice maybe would you provide to other care partners? And I know I threw a curveball at you, so I'm sorry.
At first, my role was to learn as much as I could about PD so that I had an idea what to expect down the road. I relied heavily on the Parkinson's excellent reading materials, and I found articles that offered helpful tips. I guess I just left them around the house so that Larry could read them at his own pace.
She's very subtle.
When I relied on the PF's helpline, also the pros there for guidance, they suggested that I tell Larry that I was going to attend a support group meeting and would appreciate it if he joined me because I was nervous to go alone. Ha ha. As you can tell from Larry's enthusiasm earlier, that worked spectacularly. Then as Larry became committed to a role as an exercise advocate, my role changed again and became, I had to become a supporter of his efforts, and both as a partner in our passionate project and in putting off our personal retirement goals on hold for what turned out to be a little over 5 years. As other volunteers became committed to the project, I stepped back again and took on the role of a researcher, mostly by revamping our diet to non-toxic elements and introducing healthy alternatives. We now eat a mostly organic plant-based diet that is dairy-free and gluten-free. And next we'll work on the sugar. For him, not me. I also act as a sounding board, reassuring Larry that he's not slowing down much and reminding him to speak louder and not to slouch.
So was my cue.
I am also talking to other care partners about what to expect next and how I might best support him and take care of myself too, so that I'm there for him at full strength when he needs me. I think it's important to overcome the fear of knowing what's to come, so you're not overwhelmed when a new symptom does emerge. Knowledge is truly power.
Thank you so much, Ellie. And Larry, I'm going to kick things back over to you. I know you've talked about, exercise, and we're going to continue to hammer this home because it's just so incredibly important. So Larry and Ellie are they're being modest. They, after they found out about the importance and value of exercise, they went on to found a local nonprofit, PD Gladiators, that was entirely dedicated to providing fitness programs that are adapted for people with Parkinson's and raising awareness too among clinicians and neurologists. If you have a neurologist who's not telling you to exercise, that needs to be a conversation, your next appointment, that exercise is huge. And so if you don't have somebody who's on your side encouraging you, then it might be time to find somebody who will. But in addition to founding PD Gladiators and creating this amazing, safe environment for people with Parkinson's where they can go and exercise, Larry, how did you personally make exercise a priority in your life? And was it prior to your diagnosis?
I had exercised irregularly all my life. At the time of my diagnosis, I had a foot injury. I was doing very little. And subsequently, after I learned about the value of exercise, whenever I had an injury, I found a way to work around it and get my aerobic exercise in another way. Even I was working with I had a ruptured tendon in my foot, and as soon as the doctor let me, I went on the bicycle with a boot on my foot, and
under the guidance of a PT.
Yeah. And, I still push myself. I try to get up to those 90 RPMs on the bike that they recommend. Then when, my foot healed, I went and I'd been reading about a boxing program down in Texas, where one of my contemporaries hooked up with a professional boxer and created a program. This was a time when Rocksteady had maybe 1 or 2 programs, and then there was this program in Fort Worth, and then we hooked up with Paul Delgado to form the program that's now become LWF Boxing for Parkinson's, which you saw Jeff demonstrate earlier. And that really changed our lives. I mean, that's been my primary exercise for the last 7 years. Just, Jeff and Brian Jensen and a bunch of others over the years, including Paul Delgado, who formed it with us, became my saviors. I can't thank them enough for what they've done. And Denise Formasana for continuing our work with a new wellness center in Sandy Springs that's just open. I'm still exercising virtually because I'm kind of concerned about the pandemic, but others are exercising at the wellness center and doing fine.
They do a lot of disinfecting after each class.
So anyway, besides the boxing program, we negotiated with the YMCA, and they've had 17 of their 18 branches participating in the the PD Gladiators Network, which Andy now runs. And we've tried to get programs all throughout the metro area. So that those 80 programs that Andy mentioned earlier at the beginning include all four corners of the metro area. We really thought it was important for everybody to be able to participate, especially if we were going to get the doctors at Emory to get behind us, which they have.
Yeah, you guys have done tremendous things in this area. So it's always been a pleasure and honor to work with you guys. So I want to, in the interest of time, and we're going to go over a little bit, but I think these panelists have so much valuable information to share. So please, stay on if you can. But Susan Brown is the next panelist I want to introduce. Larry, Ellie, and Cheryl, I'll probably come back to you in a moment. But Susan, I would love for you to introduce yourself and, a little bit about kind of your journey up to this point. And then I've got a couple of questions to ask you as well.
Okay. Well, I'm Susan Brown. I am 53. I was diagnosed 3 years ago. I have 2 children, 20 and 16-year-old, and I am the director of development for the Atlanta Speech School. And my father also was diagnosed in his 50s with Parkinson's. So I'm a caregiver for my parents who live in town. And that's kind of it in a nutshell. I was not, I guess I was surprised maybe when I was diagnosed, but it was familiar enough with symptoms and all the things that come with it that I wasn't completely shocked. I was probably most worried about my role as a mother. I was concerned about being able to continue to be attentive and to do a good job as a mom. And I think that was probably the thing that I had wrestled with the most. And for a while worried a little bit about that. That is not any longer an issue for me. I think that I've really made peace with my ability to manage all of it. And the fact that, long-term, it's probably going to make me a better mother and my kids more empathetic. And my husband's probably going to unload the dishwasher more than he used to. So, I mean, that's not really any longer. And I'm in an incredibly supportive work environment. So I'm kind of one of those people that just put it out there right away and said, I'm going to need everybody's help if we're going to, if I can make this work. So I don't know.
Yeah, no, Susan, that's great. And you addressed already a couple of the things I was going to ask, but, I guess if you could go just briefly talk about, obviously you're a mom, you work full time, you're a wife, there's so many things, competing with the Parkinson's, right? So how do you find time during the day to do things like relax and reduce stress and exercise and do all these things that will be beneficial in terms of your symptom management?
I think that, well, so part of it is that, it was really, you get the diagnosis and I think you really have to, at least we have in our family sort of said, as a family, how are we going to make this a priority and accomplish these things? Because if I'm at my best, then that's going to be helpful to the kids and to Frank and, my parents. So I started exercising. I would get up at 5 or 5:30 in the morning and I worked out exercising in the mornings before I went to work. And, Frank took over carpool and, my daughter helped out with that too. But, and then I also tried to work things in. So an example is that I work at a school. They have a Girls on the Run program here, which is a running program for young girls. And I volunteered after school to help with that. And I was like, well, we're teaching them how to run. That'll be great, right? I can do that as well. Sometimes it doesn't work. And I think with COVID, I realized I was probably running a little bit too hard. But but for the most part, as a family, we just made room for it. And it's just an important thing to do. So, you know, and I walk with a friend instead of having a glass of wine, or, you know, you just sort of have to fine tune what you were doing before. And, you know, the part about relaxing and finding time for yourself. I mean, I didn't do that when I was a mom before, so I'm not sure that's really taken a hit, but you just have to work it in. So I just tried to find time when I wasn't doing something before, right? I wasn't doing something at 5:30 in the morning.
Well, and Susan, you know, I know when it comes to, I mean, I'm the daughter of someone living with Parkinson's, and I know one of the first things that I did, you know, you feel so out of control when you've got a loved one dealing with something that you can't control and you can't fix. But how has getting involved in something like Moving Day, you know, our annual walk for Parkinson's, really helped you and your kids and your husband, you know, and the rest of your family?
Yeah, you know, I think that for us, myself in particular, I really needed something that was going to get me out of my own personal journey with it. Something that was going to give me a sense of something bigger than myself, something bigger than our family. And, you know, serving others and volunteering is a quick way to do that. I think too, I wanted to have some connection with my parents that was not a negative, right? I don't want to sit around talking to my dad and saying, oh my gosh, don't our feet hurt, you know, or, oh, I'm just so tired, aren't you? You know, there needed to be some way for us to be doing something that felt like we were making a difference, not just for our family, but for our broader community. And it was a really great way to bring together their friends and our family and my friends and, you know, a broader group of people with a goal. And so it's been tremendous. I mean, I can't say enough how important I think it is. And I think it draws attention to the fact that, you know, it's not just, you know, you being diagnosed, right? Your whole family gets this diagnosis and everybody's life changes. And so, you know, when we're all walking, it just, it makes me sort of just realize what, you know, the village and appreciate it. So, you know, for us, it's just been positive.
Great. Well, thank you so much, Susan. I really appreciate you being here today and kind of sharing a little bit more about your story. I'm just going to ask, you know, each of our panelists and Martha Ann, just, you know, kind of one more question, you know, put everyone on the spot here. But Cheryl, I'm going to pick on you for just another minute before you go. But Cheryl, I'd love to, you know, as you've been listening to today's program and as you've kind of reflected on your own journey with Parkinson's, you know, what advice would you give to somebody who's been newly diagnosed? You know, what is something or what is something you wish you had known right after you were diagnosed with Parkinson's?
I really have been so impressed with the materials that I've seen highlighted today that are available that weren't available 8 years ago. So obviously the resources are there now to help anyone who's been diagnosed find their way through this. But the most important thing, I think, is to find a way to take care of yourself, to exercise, to do those things that you've heard on the program today, and to find a way to find the time for yourself.
And Cheryl, I know part of this too, and I'm sure, you know, Susan, we can all relate as, you know, how has, you know, have you been able to sort of, now that, you know, you're helping your husband as well, have you been encouraged to sort of drop some responsibilities that maybe you had before, or to ask for help where maybe you weren't asking for that help before?
I have learned to ask for help. Of our children, who none of them happen to live in Augusta with us, but they've been very supportive and very helpful to me. And I've called on friends in the community. I've called on neighbors. I am not proud. I will ask for help today.
That's great. I think asking for help, especially, I know, as a mom and stuff, I know sometimes that can be hard to ask for help because we feel like we need to do it all. But I think it's really one of those things that, is very liberating when we can learn to do that. Well, thank you, Cheryl. Larry and Ellie, I'm going to kick things back over to you for a minute. What would you guys, obviously now being this far into it, you guys, Larry, I mean, I feel like you're doing so incredibly well, but I know it's been a long journey, and I know that there were a lot of really major fears and concerns, in the very beginning, especially. But what would you tell somebody who is currently right now, maybe listening right now, having a really hard time coping with this diagnosis? What would you want them to know?
I think to take all this talk about exercise as seriously as possible. By the time you're diagnosed, you've already lost more than half your dopamine producing neurons, and they don't stop dying until you start exercising at the levels recommended by your physical therapist. Can't emphasize that enough. I mean, I'll echo Dr. McLeod's advice to start exercising ASAP. Every day you delay because of denial, apathy, depression, or complacency, neurons die that you'll never get back. Exercise is hope. And the sooner you embrace it, the better your life with PD is going to be.
Thank you. And Allie, as a care partner, what would your advice to all the care partners out there be, sort of if for care partners who do have somebody who's been diagnosed and maybe they are apathetic, meaning they're not motivated, they don't, especially with it, they don't want to get out of their chair, they don't want to leave the house, they don't want to exercise, kind of feeling like, what's the point? As a care partner, what would you say to other care partners to try to really encourage them to push their loved ones to do what needs to be done?
I think the first thing I would say is I said it before about knowledge is power. Whether your partner is going through an apathetic time or just ignoring it completely, it's super important to do as much research as possible. As soon as you realize that Parkinson's is like a snowflake, no two people are the same, that allows you to say, okay, that some of the things you're reading are not necessarily in reference to Larry, but it's good to know about them. So if something does happen, I will be prepared for it. I will be able to have the strength, like I said it before, to deal with it and be there for him. I don't know. I just viewed myself as basically, I think Martha Ann used the word cheerleader, and I love to say that I'm his cheerleader. As far as the journey, I say we have Parkinson's. I think Cheryl or someone else said that. It does affect the families, and we all have to be on the same page to go through this journey together, including our children and family.
Great. Well, thank you guys so much. And Martha Ann, I know we're over, so I appreciate you guys all sticking around because I love these discussions and I think they're so important. And hopefully you guys who have been newly diagnosed are taking some real key takeaways home today. But Martha Ann, sort of in closing, no pressure, but as you mentioned, mental health and sort of the non-motor, non-movement side of Parkinson's, can oftentimes be the most troublesome and the most concerning. I mean, even having anxiety about the anxiety or anxiety about the depression that you might get, I think these are all real concerns, especially for those who have been newly diagnosed, wondering what's to come. So when would you say is a good time for somebody to reach out and just talk to somebody, whether it's, a family member, whether it's a mental health professional? What would you say about that?
Well, I think that, again, like Ellie was just saying with that beautiful snowflake analogy, that, that probably is going to be a different answer for different people. And so I think it's important to have someone that you're talking to. You know, I'm thinking the whole time I'm hearing Larry and Ellie, you know, how blessed they are that they have each other. I mean, I have, unfortunately, you know, patients who don't have a care partner, or you know, someone who is maybe committed or you know, or a cheerleader. It's not always how it works, but ideally that's what, you know. So if you do have someone, I think that's the important thing, is that you have someone. And one of the questions that had come through too, that I'm just going to comment on from the audience or from the participants, was, can your depression, anxiety, drug treatment needs change over time? And the answer is absolutely. I didn't comment on antidepressants today, but there are, you know, medicines for mood, depression, anxiety, that can also be very, very helpful. You know, I don't prescribe medicine, so I'm always going at it with the more holistic approach. But that just to be said, that can be a very important part of an individual's treatment program. And, you know, it can be, for some, maybe not, but the things we've talked about are things you can do anytime you want. There are no side effects. There's no cost to it, really. So I think that if someone, it's nice to ask people in your environment, let me know if you see a change in me. You know, if I start acting different, if you see changes, and we know about depression, everybody can feel down sometime, but if you've got that 2 weeks where it doesn't lighten up, of course, if you ever feel like you, you know, are feeling like harming yourself, or, you know, that suicide lifeline is always there 24 hours. And we know that it helps people just to talk to someone. So I think whenever you feel like you need it, or people around you, you feel like that you are changing, like it's just too much. And so whether that's a friend, whether that's a mentor, whether it's a counselor, a psychologist, you know, just someone that can help you. And as Colin, Dr. McLeod mentioned earlier about therapies, like physical therapy and those kind of things, starting them early, because you're getting skills that you can use forever. It's like that with mental health as well. You can learn coping skills early for any time you feel overwhelmed. And those are things that you then can use going forward, you know, whether you have Parkinson's or not, right? So I don't know if that was a roundabout answer for you.
That was great. That was really,
Okay.
I want people really to leave today knowing that there are definitely things that you can do. Staying active, you know, possibly changing up your diet, seeking expert care, you know, really expert care, and calling our toll-free helpline. I mean, if you need help with any of this, if you need somebody to talk to, if you need an expert referral, our toll-free helpline is available Monday through Friday, and they're wonderful. Call me, you know, I'm here in Georgia, but I'm happy to talk to any of you guys as well. I know Martha Ann at the Medical College, she's also a wonderful resource. So I just want to thank all of you guys today for being here. This has really just been a wonderful couple of hours, and I know we ran over, so I appreciate you guys staying on. We did record today's program, so we'll be providing that to all of you guys probably by next week. We're also going to provide the slides from today's presentations. I want to thank Martha Ann. I want to thank Dr. McLeod. I want to thank our panelists, Cheryl, Larry, and Ellie, and Susan. You guys were amazing. I want to thank Jeff, our awesome boxer. He did a fabulous job as well. He's always a lot of fun. I also want to, again, one more time, thank our generous chapter supporters who help make things like this possible. Accorda, Amneal, Supernus, Abby, Kieran, excuse me. And again, we invite you to learn more about our chapter partners by visiting our website. And again, please consider joining us. You know, every Monday, Wednesday, and Friday, there's something, not as long as this, limited to an hour, but every Monday, Wednesday, and Friday, we have PD Health at Home programs, a way for you to stay active and feel connected and to be empowered, you know, by the information that you'll pick up. And as I mentioned, today's program was recorded. So I just hope all of you guys, some key takeaways again: seek expert care, stay active, get involved. The Parkinson's Foundation has lots of opportunities for you to volunteer, to get involved in our moving day walks, to get involved in our local chapter advisory boards, to be a research advocate. And I know one thing we didn't touch on today too much is research, but research is so critically important. If we're going to find, you know, better treatments and a better path forward with Parkinson's, we need all of you guys to be involved. We need your help with that. So please feel free to call our helpline if you're interested in getting involved in clinical research. And I wish you all the very best. Please stay in touch with us. Please stay connected and have a healthy, happy, and blessed rest of your day. Thank you so much.